Reversible loss of vision in malignant hypertension. Definition: high blood pressure can place a strain on the blood vessels in the eyes. High blood pressure can cause the blood vessels to either narrow or bleed when they are subjected to too much blood pressure force. Also, the optic nerve may swell, reducing the ability to see well.
Hypertension is a term used to describe high blood pressure. What blood pressure is a measurement of the force of the blood as it pumps through your arteries. A normal blood pressure is 120/80. The two numbers in a blood pressure, the top number should not be greater than 120 and the lower number should not be greater than 80. The top number is called your systolic blood pressure, and that is the measurement of the force in the arteries as your heart pumps blood. The bottom number is called the diastolic blood pressure, and that is the measurement of force in the arteries when your heart is at rest. Anywhere from 120/80 to 140/90 would be considered pre-hypertension. Pre-hypertension often leads to high blood pressure, hypertension. Anything greater than 140/90 is considered high blood pressure or hypertension. The people at greatest risk for hypertension are African Americans. Also, if you have a family history of hypertension, and that's why it's important to know your family history. People who are obese are also at great risk for developing hypertension, and long-term stress increases the risk for hypertension. Smoking cigarettes, taking drugs, both street and over-the-counter medication, are risks for developing high blood pressure, and diabetes also puts you at risk for high blood pressure. Well, there are many causes of hypertension. Some of the greatest causes would be conditions of the kidney, conditions of the blood vessels, and of the nervous system. Increased cholesterol also contributes to hypertension, and of course age. As we age, our blood vessels become stiff, and that increases our blood pressure. The water and salt ratio in our body contributes to high blood pressure, and also certain hormone levels would also contribute to high blood pressure. Thank you for choosing St. Peter's.
Applications in medicine. A 35-year-old man with reduced vision in both eyes had no relevant medical history apart from intermittent headaches. On physical examination, the best corrected visual acuity was 20/80 in both eyes. Fundus examination revealed bilateral risk edema, macular edema with lipid exudates, splinter hemorrhages, and contour wool spots. The fundoscopy findings prompt an evaluation of blood pressure, which was elevated at 190/100. The patient began antihypertensive therapy, and after 1 month of treatment, his blood pressure was 120/90, and the visual acuity was 20/30 in both eyes, resolving disc edema and macular edema. Pros. Loss of vision does not occur immediately or sudden, so it may be reversible if treatment is done on time. Cons. High blood pressure can damage the vessels supplying to your retina, causing retinopathy. This condition can lead to bleeding in the eye, blurred vision, and complete loss of vision. If you also have both diabetes and high blood pressure, there is an even greater risk.
If left untreated, hypertension can lead to a thickening of the arterial walls, causing its lumen, or blood passageway, to narrow in diameter. As a result, the heart must work harder to pump blood through the narrowed arterial openings. In addition, people with hypertension may be more susceptible to stroke.
Issue applied in Ecuador. According to the INEC, Ecuador Statistics and Census Institute, in Ecuador, one-third of the population has prehypertension and 717,529 patients between 10 and 59 years old has hypertension.
My name is Reggie Murphy, and I put together a short video here on eye strain symptoms, and I hope you find it useful. When the eyes are used intensely or for long periods of time, eye strain may occur. Straining the eyes can cause a variety of uncomfortable symptoms, but in most cases, resting your eyes will provide some relief. Unfortunately, many individuals do not recognize the symptoms of eye strain, which means they may not take the time to rest their eyes when they need it. Once you become more familiar with the common symptoms of eye strain, you'll be able to easily recognize them and realize when it's time to take a break and give your eyes some rest. While there are many signs of eye strain that may manifest themselves, not every individual experiences all the symptoms at once. If you notice you are experiencing a few of the symptoms, it's time to make some changes. One of the main signs that you may be dealing with eye strain of your eyes is that your eyes are tired, sore, itchy, or burning. Often your eyes may feel dry or begin watering as well. Another sign to watch out for is double vision or blurry vision. The eyes may be having a tough time focusing when eye strain occurs, causing these vision problems. Some individuals also notice that their eyes become quite sensitive to light, or they may have a tough time focusing on a task. Surprisingly, the signs of eye strain don't just involve the eyes. One of the most common symptoms of eye strain is a headache. A headache along with sore and tired eyes is a good indicator that you are suffering from this problem. Many people also encounter pain and soreness in the shoulders, back, and neck. In some cases, lightheadedness, nausea, and dizziness may occur. Some of the other common signs that you may be dealing with eye strain include eye twitches, a feeling of heaviness in the forehead or around the eyes, problems reading, and fatigue. If you are experiencing any of the signs of eye strain, it's important to treat this problem. In many cases, making some simple changes to your environment or work habits can help improve the problem and reduce the symptoms. Reading glasses may be prescribed to help reduce eye strain. Underlying eye conditions may need to be treated to help reduce problems with eye strain. Doing eye exercises may help as well, helping to reduce the strain on your eyes. Using plenty of light when you are working close-up can be helpful. Reducing glare on a computer screen can help reduce eye strain. In many cases, simply resting your eyes and giving them a break can be enough to reduce the symptoms that you're experiencing, providing some much-needed relief. I hope you found this video helpful.
Conclusion. Malignant hypertension can result in acute, substantial loss of vision owing to ischemic optic neuropathy and severe maculopathy. Prompt diagnosis and treatment may restore vision and retinal anatomy without any intervention in the eye.
Among people who have high blood pressure, 30% don't even know about it. And that's bad news because untreated hypertension causes thousands of deaths each year.
As many as 65 million Americans over the age of 6 have high blood pressure, also known as hypertension. So what are the consequences of this epidemic? A stroke, which affects the arteries leading to the brain, is one of hypertension's most serious consequences. Strokes are caused by a clot obstructing the flow of blood to the brain, or by a vessel rupturing with the same result. Al Capone is best known for his life of crime in Prohibition America, where he was heralded as the boss of a criminal organization in Chicago. What many people don't know about Capone, however, is that he suffered a stroke while in prison, which led to his demise at the age of 48. People with hypertension are 8 times more likely to suffer from strokes like Capone's than people with normal blood pressure. In fact, high blood pressure is identified as the #1 risk factor for strokes. Can result in.
Thank you for listening.